All right. Well, good afternoon, everyone on the East Coast. Welcome to our this Friday's webinar, led by our very own Dr. LaTasha Lee with the National Minority Equality Forum on domestic violence, a pandemic within a pandemic. Dr. Lee was introduced to our panelists from one of our very own 40 under 40 recipients, and wanted to make sure that we discuss this very important and topical issue. So, without further ado, I'm just going to turn it over to Dr. Lee.
Thanks, Brandon. So I'm just going to give a few introductory remarks and introduce our very esteemed panelists for today's discussion. Really, as Brandon mentioned, this pandemic has put a glaring spotlight on the gross racial inequities in society, which cut across every facet of life. Not only are communities of color disproportionately affected by chronic health issues and disease, but they're facing enormous challenges as it relates to interpersonal violence, particularly domestic violence. In October is National Domestic Violence Awareness Month. Domestic Violence Awareness Month was launched nationwide in October of 1987 as a way to connect and unite individuals and organizations working on domestic violence issues while raising awareness for those issues. The theme of this year's campaign is Everyone Knows Someone, and it strives to highlight how common domestic violence is, and that it is more than physical violence. I want to give you some quick statistics. On average, nearly 20 people per minute are physically abused by an intimate partner in the United States. And during 1 year, that equates to more than 10 million women and men. 1 in 4 women and 1 in 9 men experience severe intimate partner physical violence, intimate partner contact sexual violence, and or intimate partner stalking with impacts such as injury, fearfulness, traumatic stress disorder, victim services, contraction of STDs, and etc. Additionally, 1 in 3 women and 1 in 4 men have experienced some form of violence. This includes a large range of behaviors from slapping and shoving to pushing, and sometimes other things that may not be considered domestic violence in the typical sense. Since the outbreak of COVID-19, emerging data and reports from those on the front lines have shown that all types of interpersonal violence, particularly domestic violence, have intensified. This is what we call a shadow pandemic growing amidst the COVID-19 pandemic. As COVID-19 cases continue to strain health services, essential services, and domestic violence shelters and helplines, many have reached capacity. More needs to be done to prioritize issues of addressing domestic violence in the COVID-19 response and recovery efforts. Joining NMQF today for this important discussion on the topic of domestic violence, a pandemic pandemic is Ashiyanaa, formerly ASHA for Women, a nonprofit founded in 1998 that provides culturally sensitive support and services to South Asians facing interpersonal violence or domestic violence, empowering Jaya Nelliot, a board member and chair of the outreach committee of Ashiyanaa. Jaya is an Ayurvedic practitioner and holistic coach. She joined Ashiyanaa as a volunteer advocate in 2009 and worked with clients to address issues, develop and implement appropriate solutions, and navigate and access social service benefits and community resource with the ultimate goal of helping them attain self-sufficiency. Since 2013, she has served on Ashiyanaa's board of directors and currently chairs the outreach committee. In her role, she leads community outreach, partnership building, and cultural competency training. Our next panelist is Archana Dogra. Dr. Dogra is a licensed clinical psychologist and board certified neurofeedback specialist. She is an independent private practitioner in Manassas, Virginia, practicing counseling and neurofeedback in children, adolescents, as well as adults. Prior to starting her practice, Dr. Dogra supervised and directed programs such as intensive in-home services, day treatment programs for school, and outpatient counseling services for county and community at-risk youth. She has extensive experience and over 2 decades of working with trauma, anxiety, depression, and other emotional and behavioral disorders. As a committed mindfulness practitioner, her approach is holistic and mind, body, and brain-based. So with that, I'd like to turn things over to Jaya to provide us a bit of background on Ashiyanaa and the services that the organization provides.
Thank you, Tasha. Good afternoon, everyone. I don't think I have to introduce myself. I am Jaya, and here I am to present Ashiyanaa to you. Just to let you know, Ashiyanaa is, as of now, 12 hours and 6 minutes old. Until now, we were known as ASHA for women. At midnight today is when we got our new avatar. If you give me a second, I would like to share my screen with you and get going. Hope there are no genies. Okay. Yes. Are we good? Can you all see my screen? Thank you, Tasha. So here we go. This is all about Ashiyanaa today. We are here to serve South Asians. We were formerly known as ASHA for Women, founded a long time ago, 1989. Almost 32 years, started at a kitchen table by 4 women from India, Pakistan, and Bangladesh to help their sisters and the children impacted by domestic violence. So it started as ASHA. ASHA means hope in a lot of South Asian languages, and it was to give them hope, to be self-sufficient, to live in a world free of abuse, to be who they are, safe in their own homes. So that's how we started in the DC metro area 32 years ago. And today, like I said, 12 hours ago, we become Ashiyanaa. Ashiyanaa is, again, a word from a lot of South Asian languages. It means home, and our values are enshrined in the word home. If you go to see, it's hope, open-mindedness, empowerment, and equality. So the hope is continuous. We hope for the best for all of us, not just South Asians, for the whole world. And we're talking about domestic violence today, a pandemic, unfortunately, which is much, much older than the pandemic we are experiencing right now, almost from the times humans occupied this earth. And it continues. And hopefully all of us together, it takes more than a village. We are going to eradicate that pandemic of domestic violence. Open-mindedness, we welcome everyone. We are inclusive. We do not discriminate on the basis of gender, age, social identity, financial status, you name it. It is every individual and every family. Our mission, it continues to be the same, just to continue, but here we are not just women and children, we are talking of families, individuals, just for them to leave, is to create these culturally sensitive pathways to empower individuals and families in the South Asian community. Just to give you a little idea of who we are as South Asians, see the map here, we come from these countries, Afghanistan, Pakistan, India, Nepal, Bhutan, Bangladesh, and Sri Lanka. So these are the origins. And again, to give you a little idea of how we came here to the United States, it was in the late 1800s that the first South Asians arrived on the West Coast, and in the early 1900s on the East Coast. Initially, it was a trickle, and I understand it was for menial labor, but in mid-1960s, when the law was passed for non-Europeans to come here, is when more South Asians came in. And by late 1960s, with the Family Act, there was much more of an influx. Initially, students from these countries came here for higher studies, professional schemes. So there was this group of people who were considered to be pretty well-rounded. They were well-educated, they had good jobs. But as time has passed, we see that the immigrants are from just the whole gamut of society, like anywhere else in the world. What defines us as Ashiyanaa? Like I said, respect for all ages and gender, all religions. To give you a little idea, South Asia is a home for almost all religions under the sun. And most importantly, the respect for family structure, the bedrock of a South Asian community. We understand the culture since we come from there. We speak the language and so can build information bridges. Talking about language, just a little aside, of the 1,000+ living languages in the world, South Asia is home to almost 600 living languages. To give you a little more idea of it, you take a country like Bangladesh, which is the size of the state of Georgia, and they have 39 languages. Some of them indigenous, some of them foreign, some of them acquired from other places. Or you take a country like Pakistan, double the size of California, 74 languages. Or then you take the biggest country in the place, India, 20,000 dialects and counting, and 23 primary languages. Not to say that we speak all these languages, but we do manage. So this is what we know about our community, and this is what we would like to share. The reason we are here serving South Asians, it's because we understand the culture, and most importantly, the family structure, which is a bedrock of the community, the family integrity. There are a lot of social norms based on the culture, a lot of taboos and mindsets. Every family is a collective. It's not a single unit, and it's headed by the male in the family. It could be the father-in-law, it could be the husband, or it could even be the adult son. Again, just to give you a little idea, in Southeast Asia, marriage is not considered to be just between two people. It's called an alliance. So it's not you marrying into the family or you getting a spouse there, it's your extended family, your cousin, their cousin, everybody's involved. So a wedding is literally an alliance of plenty of communities coming together. The next thing that we do understand about a community is the intergenerational conflict. We have South Asians who have come here a long time ago as students, have had families here, the children are growing up here, and then we have South Asians who have just come here from their home countries, from remote villages in their home countries. So just the conflict of understanding where the children are coming from the way the youth are coming from, or the seniors that we have who have transitions. There are seniors like me. I don't want to say much. I know if somebody said 40 under 40, I'm happy to hear that, way beyond the 40. But transitioning into seniorhood here, people like me, or those who have come here to be with their children and grandchildren. So there is always that intergenerational conflict. And of course, the acculturation issues. These differences that are seen in the community is what is a big deterrence. It's really hard for the ones who need help to seek help. Tasha has given quite a concept of what domestic violence is. I'm just going to go a little more in detail about it since this is Domestic Violence Awareness Month. And like I said, this is a pandemic that started way before any pandemic, not known then as a pandemic. And to begin with, it was just considered that if you were beaten up, you had a broken body, bruises, black and blue, yes, may be considered to be a case of domestic violence. So it was all physical. But just like our COVID virus, which is now mushrooming out, getting a lot of variants, there are other parts of domestic violence too. And with time, these are being recognized. So whether it's verbal abuse, public humiliation, stalking, social isolation, abuse of children, sexual abuse, psychological control, threats and controls, it all comes under the one umbrella of trying to hold power, trying to be the controlling person. And now we have new ones too, spiritual abuse, which we're seeing a lot of these days, or technology abuse, with where the world is going. In the South Asian community, all this exists, but the impact is a little different just because of the culture and who we are as people. I do have some data here, but unfortunately it's 5 years old. Hopefully with the new census and with help from people like all of you here, we would be able to get more data. So 4 out of 10 South Asian women are supposed to be impacted by domestic violence, and 1 in 10 men and people of the LGBTQ+ community. The reason we do not have much data and people do not come out is just a few that are mentioned here. I'd like to go through them quickly. Fear of government authority. This is something that's carried over from the home countries. We know the feeling of being subjected to authority is a deep, deep fear. It could be because of the immigration status. It could be because of children who are born here. Then there are the social taboos and family pressure, where it's not just the family you're living with, the joint family you may have here, the family structure, which is your go-to for help and just to be who you are, but it could be your extended family. It could be your parents, it could be your siblings. Then, of course, like I said, the language, with all the languages that are there. Then the traumatization by the oppressor, which is the cause of domestic violence, and the fear of, most importantly, the fear of children being harmed, or fear of children being taken away. Most of these fears are not from experience, but it's more from what the survivor may have heard from the community. The survivor may have been told this is one way to keep her under the thumbnail of the oppressor. So for us at Ashiyanaa, our main aim is to empower. Our only goal is to empower, to make them self-sufficient, whether it's financially or socially. So we have this three-pronged way of doing it. It's by guidance, by referral, and by direct support. In a case management, when we get a person in, somebody who comes to us, first and foremost, we do determine the issues and the needs, because they're very specific and they're very vulnerable. And with the client, we work the client to find ways, to determine pathways for them to find self-sufficiency, to be empowered. We are there to guide them just through any situation, because of the language we speak, not just the language of this tongue, but of the heart too, because of the culture we understand. Our empowerment program, like I said, is to first find individual needs and then find appropriate, customized, and holistic solutions. That's the way we go. All our approach is holistic. We also provide safety protocols, emergency survival needs, and referrals to psychological and legal services. We give them counseling, which is both, again, therapeutic and job related, just for them to make sure, again, end of the day, it is empowerment, having them stand on their own feet with no dependency at all. So for clients who seek help, it's really easy. We have a toll-free, safe, secure, and confidential helpline, and it's answered by the client services manager, who has been with us since almost the inception of our first ASHA for Women. All the voice messages are heard back and responded to within 1 business day, and every information, every little bit that is told to us is protected. Being from the community, I know we are easy to speak with, but that's again a double-edged sword. The confidentiality of our clients is what will bring them to us, is what will make them comfortable with us. So we are very, very careful about the confidentiality part. The other part of ours is to bridge bridges of understanding and information. We have partnerships with counties, with government, lawmakers, law enforcement, social service organizations. Any part of this is for our clients, is to make them self-sufficient, to give them that goal. Like I mentioned before, we are an underserved population, despite having the myth of being a model minority. We have communities in the South Asian region, from South Asia, not South Asian region, who come below poverty level in the US. They are challenged for education, for healthcare. So also, although we are perceived as a model minority, because there are 95% of South Asians do have at least an undergraduate degree, but the 5% could be who need a lot of help. And that's where we come in. We want to have their voices heard at platforms like this, so we know we can get the help they need. So just as a baseline, our job here at Ashiyanaa is to inform, to educate, to interact, and associate, to open doors of understanding and help our clients. We do prevention and spreading of awareness, because as here we are talking of pandemics, prevention is the best cure, nothing like it. And the prevention is to help the perpetrator who needs it. It's not something they may want to do at all times. I'm sure once they're educated, once they understand the harmful effects on not just them or their spouse, but on the children. That's where we come in. We want to help them come out of it. We want to bring it out of the closet, because there's a lot of denial in the South Asian community about the existence of domestic violence. So we do programs, we go into the community, we go to places of worship, which is where the South Asian community congregates, where they have shared their thoughts and feelings. We arrange forums and seminars on cultural diversity and work with other agencies, like I said. Just an average stat of who we are. Since the last 32 years, every year, we've been serving around 100 to 120 women. We get about 400 inquiries, emails, phone calls, and we serve 90 to 100 children. Although we are serving in the DC metro area, that's where we are based, we do get calls from across the US and from the home countries. The funding for our program is, again, from our community mostly, but we do get help from other resources. Just to give you an idea, the transparency and accountability is very important for us, and we are there. I'll come back to the bottom. If you see, we have a platinum rating on GuideStar. This is because who we are. And this year, we are very, 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 very proud to say, out of the 12 plus million, almost 13 million organizations that applied for this, we are one of the 12,000 that got it. We, a small organization, just run by a little group of people. And since most of us are volunteers, and now in the next slide, you can see who we are, 96% of every dollar that we get goes right back into our program. So a quick look at where our money comes from. It's individuals, fundraising, companies, foundations, and organizations. And again, 96% goes right back into the program. A quick look, this is our board of directors, all volunteers here, 8 volunteers who do the work. We are a working board. We work 12 to 12, not 9 to 5, nothing. It's on around the clock. And then we have our client services manager, who's a part-time. She's the one who manages the helpline and is been with us for the longest time, like I said. And in the past 1 year, we have hired 2, a social worker and a program manager, just because of the way the cases are getting and just because of what we want to give our clients. These are the different committees we have to help us in our works. And I did mention about our staff and our board of directors, but I have to tell you about our volunteers. They are our cornerstone. Without them, we could not do anything. And we have 30 to 40 of them. They step in, help us every time we need something, whether it's helping with the gala or taking a client to court or just doing things that we cannot do and which is needed. We depend on our volunteers, donors, community. We are a member of United Way. We are a member of CFC, which you may have heard, and this is where from we get a donation. And like I said, 96% goes right back into the program. So that is us. Thank you for listening. I just want to say one thing about the pandemic. Please let us all join together. It is so important that we do this because of the way things are going. We just have to do it a little different from what we're doing for COVID-19. We remove the masks. We talk. We are not hiding behind masks anymore. We are not going to be in denial. We are going to bring it right out. And no social distancing. We are going to get closer and help those who need, because it takes a village. It takes more than a village. And we're going to shine a light. That's going to be our vaccine. Shine a light so bright that nobody can hide behind any excuse, because no religion condones domestic violence, no culture condones domestic violence. All that we say is everybody, no matter who you are, has to have a safe haven, your home, your peace, and your self-sufficiency. Thank you again. Thank you all so much for listening. Thank you, Tasha.
Thank you, Jaya. So thank you for introducing us both to Ashiyanaa, the topic of domestic violence, and we'll hold the questions for the whole panel to the end. Dr. Dogra, I'd like to turn things over to you to provide a little more context. And while she's queuing up her slides, the staff has put Ashiyanaa's website into the chat. So feel free to reference the website to learn more about the programs and the issues facing the South Asian community as it relates to domestic violence. Without further ado, Dr. Dogra.
Oh, thank you so much, Tasha. So I'm going to be talking about a little bit more about the neurobiology of domestic violence and how it really impacts the victims. So, okay, there we go. So this definition really captures a lot of what we call the domestic abuse, also called domestic violence. Intimate partner violence, it can be defined as a pattern of behavior in any relationship that's used to gain or maintain power and control over an intimate partner. Now, Jaya talked about the power and control of how the whole domestic violence really plays into that, The abuse is physical, sexual, emotional, economic, psychological actions or threats of actions that influence another person. Now, this includes any behaviors that frighten, intimidate, terrorize, manipulate, hurt, humiliate, blame, injure, or wound someone. It can occur within a range of relationships, including couples who are married, living together, or dating. This, I thought, really captured the whole, the scenario of domestic violence. Now, we know that it's not limited to, it can be in all societies. We are talking about the South Asian society today, but we know that it's not limited to just the South Asian society. So you have all cultures, any race, any age, education, religion, does not matter the sexual orientation or gender, but we do know that it is more towards women, and the LGBT community has been really impacted much more than the rest of the communities. We're going to be talking a lot about the social isolation, more so in the pandemic, because the victim is just isolated in the home. There is absolutely no way to go out, no way to communicate with other people. So they're more socially isolated. There are a lot of threats that in case if you go out, in case if you tell someone something, that this is what's going to happen. And now because of the social media, there is just so much that, okay, I'm going to post this on Instagram, or I'm going to be posting this on any other social media. So because of the threats, there is more social isolation. The abuser is one thing which I have found, and it's again in most societies, but I have worked very closely with the South Asian community and with the domestic violence that happens in the South Asian communities. The victim is really well known in the society. He's respected, has a high-powered job, and tells the victim, hey, nobody's going to believe you because this is who I am, and I'm really, everybody knows me, but nobody knows you. So who's going to believe you here, me or you? There is parental alienation that's always happening in terms of the domestic violence, which is, it's used pretty often, that the kids are going to hate you if you tell against me. Your kids are not going to like you. And, one of the cases that comes to my mind is when this dad who was very well known in the society, and the child knows that this person, and who's my parent, has been physically violent towards me and my family, towards my mom. But yet, because he's so well known in the society, it's easier for the son to be a part of work with the dad and say, okay, I doubt my mother here, but I know that, you know, the tens of thousands of people out there who are listening to my dad, and I got to trust him. So there is some kind of a parental alienation, and the abuser does that quite a bit too, that your mom's wrong here, she's not right. Again, with the pandemic, the abusers we find have been more manipulative. There are also, as the numbers are rising, we find that there are also fewer opportunities to report, you know, because the person is more in the vicinity, and the access to the agencies and to other people, it's much less. Of course, the lack of friends, especially for the South Asian women, there are lack of friends and family in the region. So the perpetrator controls their exact movements, stalking, tracking. You know, not going to the grocery stores. I'm going to be getting the groceries. And plus, a lot of women don't know how to drive or to be able to go there. So they're more and more dependent and more socially isolated. So yes, would love to know some of the latest, you know, the data, because I think it's way more than what's reported. So the victims obviously feel very trapped in the marriage where they are, sometimes trapped in the country, not knowing what to do, how to do, don't know the legal system, don't know how to proceed. So there is a lot of just a lot of helplessness and fear. And we're going to be talking about the helplessness and fear. And when children are present, there is the cycle of intergenerational trauma that we are allowing that to continue, because again, there is a lot of research that's been gone on intergenerational trauma. There's a very famous, the multiple studies, but one is very famous is mice were taken and the cherry blossom smell was paired with the shock. And so they found that the grandchildren of those mice reacted to the smell of the cherry blossom. So this is the intergenerational piece that we're talking about here, right? There's so much of research on the Holocaust survivors about how the generational trauma, the fear just continues down the generations. So here we are, the children seeing what's happening, and you know, it continues. Just with my, a lot of my cases and a lot of my, with my colleagues, I find that there are generally three types of victims that are there. They're usually victims from South Asian countries. They're married to an immigrant. There is no history of violence in the family of origin. And when they are here, they're taken by surprise, because initially the perpetrator was very, as we know, started off with a cycle with wooing and with saying, oh, you're the greatest person in this whole world. And when they come here, you know, the honeymoon phase is gone and they are in the relationship. But then there are so many questions of why the victims are unable to leave. And this is one of them, that because the honeymoon cycle continues, you know, that cycle continues, right? There is physical violence, and then there is the honeymoon phase. And then the victim continues to stay in that. A lot of times with the South Asian descent, second generation born and raised in US, they date boys who are nice, and until they find out the pattern. But then what happens is, because again, in the South Asian community, there is a lot of, just like what Jaya mentioned, it's not two individuals marrying, right? It's two families coming together. It's multi-generational coming together. So it is a matter of pride. Oh no, this domestic violence incident cannot go out of our family, because what are people going to say? What's going to be happening? So they try to keep it more closed, so the victim is more isolated. The third type is sometimes those victims have been exposed to domestic violence prior to their marriage while growing up in their family of origin, and they're unable to get out of the cycle, and they feel that this is the norm. So the impact of domestic violence is on multiple levels. It's psychological. There is definitely a huge impact on your self-esteem, You talk about blame and guilt and shame, feelings of helplessness and fear. There is anxiety, depression. PTSD, of course, is there, which is multiple flashbacks during the day. There are nightmares at night. People, somatically, they're not able to sleep. Chronic fatigue syndrome and fibromyalgia, gastrointestinal issues, cardiovascular, kidney, bladder infections. A lot of times, some of these victims have given them some, sexually transmitted diseases. Neurological, a lot of these victims have been hit or kicked or slapped or choked. And at some point of time, if they've had a concussion, nobody knows because it's been, again, covered, right? You have migraines, you have headaches. The brain inflammation is just so profound in some of the victims. Excuse me, I do what is neurofeedback, and I do a lot of EEGs of the brain. And when I see some, if I'm working with a victim, it's so evident. A lot of people don't know how much tension they're holding in the body. It's just not very common, right? So when I'm doing an EEG, I see a ton of tension in the jaw. That leads to tension in the neck and the shoulders, back to the brain, gives them headaches and migraines without them knowing where it's coming from. And I can see it on the screen, and I'll tell them to relax the jaw, and they'll say, no, my jaw is relaxed. No, just take a deep breath and relax your jaw one more time. And then I'll show them the EEG, and then they'll say, oh my gosh, I didn't see that, or I didn't notice that I was holding so much tension. So it's just a little bit. And, so noticing how much impact it is, the choking with the lack of oxygen to the brain, it's pretty significant. So this is one of the clients I'm currently working with. And it's just a sad story. I'm not going to go into the details because of the lack of time. But she's been in therapy actually for the last 20 years, but there is a ton of, grew up in a family of domestic violence, married to an abuser for 20 years, and currently, again, is in a relationship where there is no physical violence, but there is emotional abuse that's ongoing. And we are working with parts of her. I work with internal family systems and work with parts of her. And this is her helpless part that she drew, that she's holding on or clawing to just a cliff and is going to fall off any moment. This is what she described as fear for her, which you can look at the picture and feel that. And this is all telehealth, by the way. So I have her do it, and then she holds it up, and then I take a picture. Okay, we're going to go into that later. So I want to touch base a little bit on the neuroscience of trauma. And when the fear kicks in, your prefrontal cortex, which is the thinking and the attention-seeking part of the brain, that's impaired. Now, guess what? For the perpetrator, the prefrontal cortex is in control. He's manipulative. He knows his behaviors are habitual, and most times they're planned. So we know that the victim's brain states are different. The victim is coming from a very terrified fight or flight freeze state. And the perpetrator is coming from a place of confidence and manipulation. There is no match right there. The victim is in a constant state dependent, there's fear circuitry that's going. It's very moment to moment. It is so visceral because they don't know what's going to happen next. They don't know. There's so much of unpredictability that's there, I had, again, because I work with just so many cases, one of them, she mentioned that things could be going just fine, but the very next moment, this person could come and just smash her head against the wall and said, hey, you didn't make me the right cup of tea. right here. Oh, you missed this, but this is exactly the same tea that she's been making him for years. But he wants it to be presented in a different way today, but she doesn't know. Your HPA axis is shifted, your hypothalamus, pituitary, adrenals shifted. You find that there are fewer GABA receptors that are flowing. There is higher rates of norepinephrine. So I do a lot of psychoeducation with the victims of the brain. I find it helps them so much to take away that guilt and fear and say, hey, it's not you, it's the brain who acts like this sometimes, because that's really what the brain does. Now, if you see that, you have that amygdala right up there, which is the threat radar of the brain, and you have the prefrontal cortex right there. So sometimes what happens is, if you look at what is called a triune brain, you have the, let's start from the bottom, is the evolutionary brain, and and that's the fight flight brain. That's the reptilian brain. So the lizard is not going to think, it's just going to go away in a flash of an instant. And then you have the mammalian brain, which is the limbic system. And then you have the neocortex, which is the thinking part of the brain. Sometimes when the limbic system becomes so huge and so big that it takes over all the space, with the result, you're not able to think really what my decisions are. Can I call 911? Can I talk to somebody? When I do have an officer who does come in, am I able to say what's going on? It's very hard for them, not because they don't want to do it, but because the limbic system is just taken over, and the frontal part of the brain, the executive part of the brain, the decision-making part of the brain, it doesn't leave much space right there. So this guy called Dan Siegel, I'm going to check the time here. This guy called Dan Siegel, he came up with a really nice thing called the hand model of the brain, and I love it. And I do this exercise quite a bit. So this is, I don't know if you can see this, is like a picture of a brain in my hand. And everybody has a brain right there if they just make a fist right there. And the front part of the brain, this is the, which is right up here with the prefrontal cortex are your eyes, and this is the back and the sides of the brain. So, and this is your mammalian, the limbic system part of the brain. So, this is how the brain is when it's nice and integrated. But when the limbic system right up here, it pushes a lot because it cannot take anymore. You saw those pictures of fear and helplessness, can't take anymore. So the limbic system really becomes big. And what we do is we flip a lid. When we flip a lid, the medial frontal lobe right up here is not in touch, because the medial frontal lobe also helps to calm down the brain. And when you flip, you're not able to think well, you're not able to reason well. And imagine if the victim is in a state of the brain being flipped, that's how the victim is walking most of the times, right? And the perpetrator, when the perpetrator gets angry and upset and mad, he flips a lid like at the drop of a hat, and not thinking in that moment. And so two people walking around with flipped lids, it's hard to be able to, there is violence and then there is more of it. Some of the factors which are influencing the immigrant domestic violence, we find that, of course, there is immigration-related abuse. There's fear of deportation. You're going to go back to your country. You won't be able to stay here if the kids are here. They are, some of the kids have been born and raised here. They don't know anybody back in their country, and then they fear that. There are language barriers, of course, and the cultural barriers, as Jaya pointed out, that again, it's, when you have a father-in-law dictating the whole situation, it's a very different way of living. And, the victim is obliged or obligated to listen to the man of the house, So there is lack of culturally competent social support, which is there. Financial constraints if the person is not working. There's lack of understanding of the legal system. I've had a lot of times where people come in and there is misdiagnosis because they don't know also how to explain to the legal system, this is what I've always been doing, and this is what I'm doing here, but how am I in the wrong? Or, concerns over loss of children in custody battle, which is also huge. So moving forward, excuse me, I'm going to just, I know my time's up. I'm going to be pretty quick here. We do want to create a space of trust and safety. That's to begin with. The grounding and stabilization work is super crucial. It's really important. The somatic self-regulation is equally important. We can work, we can reason them, we can tell them a lot of things. But unless you work with the body, because the body keeps the score, there's this guy called Bessel van der Kolk who's written this beautiful book on body keeps the score. And unless we work with the body, you're going to keep having those memories come up again and again. And neurofeedback, I found, I've been a psychologist for 20 years, but with neurofeedback, I find I can really calm down the body and then work with the brain, and they're more able to be open and verbal and say what they need. Psychoeducation, work with a lot of cognitive awareness with the therapies. And again, creating that positive, empowered narrative, as Jaya mentioned. I love the concept of empowering the victim, letting them know that they are the ones who are in charge and creating a new norm for them, and saying that, let's begin to create a new norm for you. The resilience work of a lot of hope, and know that it's very typical for the brain. And if you're a therapist, you know that when a victim has been in a state of fear for the past 20 years, they're not going to flip a switch and say, okay, I'm not fearful anymore. It's not happening. So it's important to begin the resilience work here. So this is a picture of hope that the same client created. And we talked about it, and you'll see the difference between how it was in terms of fear and helplessness and what hope means to her. And there are a lot of sites on self-compassion. There is a lot of research on self-compassion and trauma. Tara Bragg does a great job with mindfulness, and she's come up with RAIN, which is to be able to recognize what's going on. And this is more therapeutic, and it can be started off in the first instance. It's maybe after multiple sessions. So these are just some of the resources, and I know my time's up, so I'm going to stop. Thank you.
Thank you for that, Dr. Dogra. I really appreciate all of the educational. I'm a neuroscientist by background, so I really appreciated the connection and the discussion around the neuropsychology associated with domestic violence. I really want to hone in on something that Jaya first mentioned, and I'd like both of you to elaborate. What do you mean by spiritual abuse and technological abuse? Those are two that I am unaware of, and I'm not sure if our audience members are as well.
Sure, I can go first if you'd like. So spiritual abuse, so each one of us, whether we believe in religion, I'm using the word spiritual, not religion here, because for me, it's very different, and I'm sure it's for a lot of people. So spirituality is what you feel within yourself, without not in the confines of any religion, so to say. So if you are spiritual and you want to practice something, but your perpetrator is not going to allow you. So that's one way of abuse. Either you want to do something that the religion is asking you to do and the perpetrator says no, or the other way around, you don't want to. So that's the abuse that comes in, and it can be very demeaning because it makes you feel unworthy, as all domestic violence makes you feel. So that's where the spiritual abuse. So just not letting your spirit prosper, not giving you that empowerment to be who you are deep within you. And technical abuse is basically now where we are. People they monitor you on your Wi-Fi, on your phone. We have a client right now whose husband has put cameras around the house. excuse, it's for security. I'm protecting you and the children. But no, he's just monitoring us. So technology has its positives, but unfortunately for clients of survivors of domestic violence, it can be a challenge just to circumvent that. So for us with Ashiyanaa, we try and give them a phone, which is theirs personal, because the other one could be what somebody else, he has it too. Same with computers and things. Thank you.
Thank you for that. I really want to kind of continue that discussion of technology. As you know, we're doing this via Zoom right now. And how do you think the pandemic has exacerbated the issues of domestic violence since we're no longer connected like we used to be? A lot of people are living in isolation. Their only interaction with sometimes the medical community or services like Ashiyanaa's is virtually. How is that contributed? Because no one can see your bruises easily. I can easily cover them up, or I could put makeup on and disguise it. I could use those interesting filters on Zoom to hide some of the issues. Could you elaborate?
Absolutely, because you can hide those bruises. You are very cued in again to the victim's face, and to recognize what's happening with the eyes, what's happening with the jaw, what's happening with tightening the shoulders. Is there anything somatic that you can find that is there? I do also, have them stand up or just walk around the room and see how that is, because you can see what really is going on. But that's a good exercise. It's just to very nonchalant, is okay, let's just take a deep breath and get up from our chairs and just, the mountain pose, do a little bit of that, and then have them back in their seat and see how comfortable they are.
Jaya, anything to add?
Yeah, it comes to the same thing. We are having a challenge. Our advocates, although they're well trained, they're culturally sensitive, but just getting to talk to their clients through Zoom, or maybe not Zoom sometimes. You may set up and then the perpetrator comes into the house. There is no way to go. Libraries have been closed. It has been more than a challenge. And that was one reason that in the first half of 2020, our numbers went down, as it did across the board for DV all over the world, because they were with the perpetrators. The only way for them to contact us would have been through some kind of technology, and not happening. It has gone up again now, but unfortunately, it's not, we know where it should be, because like I said, DV has not disappeared from the face of the earth. Yeah. It's just that the challenges of technology again come in there.
So you mentioned something in your talks about the model minority. I was introduced to the topic from Meghana and Nishant. The Asian and South Asian community often are seen as the model minority group. But do you think this is a double-edged sword when it comes to domestic violence? And does this notion impact the issues of awareness and referrals by the clinical teams, because they don't think of domestic violence right off when they're seeing patients from these communities?
Yeah, you want to go, Jaya?
Sure. Yes, model minority, like you're so correct, Tisha. It is a double-edged sword, and that's what we are trying to literally bring it out of from under the rock. Fortunately, when we first came in as immigrants in the late 1960s, like I said, it was students who have now gone on to become really well-educated, well-settled. But that does not mean DV does not exist. We have clients who are doctors, who are PhD, who are just the whole gamut, and they need help too. They cannot come to us just because of myriad of reasons. It may not be immigration, which is what new immigrants face, but it's just the stigma or not having your children. I'm sorry, I get a little emotional when I talk about our clients and what they have to face. But it is really hard, because when you say, oh, South Asian, oh, they're either a doctor or they're a lawyer or they have these high positions. No, it's not the case. You could be a doctor. At present, we have clients who are both doctors. And after 25 years, she's decided to take a step forward, to come out of it. Yeah, it is. And it's really something we want to just not tell people, because we are who we are, we do have the same issues. We do have the same needs and help. We do need it.
So I want to read a comment from the chat. A classical sign of physical abuse with this individual's patients, which is often overlooked, is missing front teeth. With women being punched in the mouth, dentists must also be aware. And so when we were talking about this webinar, we were also talking about medical intake forms. And I was sharing with you that, you know, I am finally going into the doctor. I've been one of those bad people who've skipped going to the doctor during the pandemic, and, you know, filling out those patient orientation forms or intake forms. I've never been asked this social determinants of health questions, the safety questions, physical violence questions. I'm not a victim, but it just is remarkable that sometimes those questions aren't asked. So can you talk a little bit about that? And then on that same question, what do you feel that some professionals must do to kind of begin to broach that topic with their patients?
Yeah, you can, that is so true that none of those questions are addressed. You know, and you would really would like for those questions to be addressed, and they're just not there. You know, and the only time something is addressed is when you know, when a doctor is super aware of any of the bruises or anything that are visually seen. So yeah, that I wish it would be taken up more than what it is right now. I wish it would be addressed more. And I think it's just a basic general question, like, you know, if you have any kinds of a little bit of a minor doubt, you know, who's in the home, and just a simple question of, do you feel safe, is important.
Do you feel that maybe in the medical community there could be more attention to domestic violence, some, you know, introductory training on how to broach that topic? People in the chat are saying absolutely.
Yeah. Absolutely. And it's not because they may not want to do it. It's just it's such a fluid topic that you cannot ask somebody whether there is violence. You have to be a little more nuanced about it. We have clients who go and may have had bruises. So the typical answer is, I fell down the stairs, or I banged my head. So it would be a little more than just asking that one-off question. It would be just developing a relationship and talking, and maybe not in that visit, but you will break it up. You will have them talk to you about it, and getting the perpetrator out of the room. Talking again about South Asians, if you find that for some reason there is no way that the spouse is leaving the room, red flag. And we request them, and I think you brought this up, Tasha, having something in the restroom so the spouses, the survivors, can have an avenue when they feel comfortable to talk or reach out to people like our organization who does this.
Yeah, on that topic of restrooms, I had shared with you, my OBGYN office has separate restrooms for males and females. So if you're coming in with your partner and in the female's restroom, there is a domestic violence. But one thing I was thinking about, you know, slip that someone could leave behind if they're needing help. So I'm going to take two more questions. There was a comment about in your remarks, as well as in the chat, about feeling trapped in country and not knowing what to do. Can you talk a little bit about not knowing the rules and how immigrant populations in particular are challenged by domestic violence, and how to seek resources?
Yeah, absolutely. So a lot of times, and I'm thinking of maybe a case here, is when, you know, they're newly immigrated parents, and the child apparently was misdiagnosed again at a medical doctor's office, and taken away to a foster home. The parents absolutely had no idea of the rules. They had no idea of how to approach, who to approach, what to do, and just went through the system with whatever was being shared. So it sometimes with the with the victims who are inside the home with no jobs, with nothing available. They really feel trapped inside the house and within the country because their family and friends are somewhere else. Yeah.
Jaya, any remarks there?
Yeah, I would just say, just it's word of mouth. Most of our clients come through word of mouth. It's the 6 degrees of separation of Kevin Bacon. Of course, I'm dating myself for most of our audience who wouldn't know who I'm talking about. But that's what it is, word of mouth. We try and we talk wherever we can. Just put our name out there, let clients know, let people know who need help. Come to us. And for us, it's places of worship, it's cultural events. It's the most the places that you wouldn't think a domestic violence survivor is going to come in and say, oh, please help me. Just leave it there. Cards, your flyers, and talk to everybody you can. That's the one way to do it. Pull off the mask, start talking.
So also, I want to just note in the chat, the staff has placed the National Domestic Violence Hotline there, as well as Ashiyanaa's website. So in the last question I'm going to answer, we're going to ask a question that was posed in the Q&A. So as Jaya mentioned, there is limited data on not only South Asians, but underserved populations in general. So in your closing remarks, what do you think we can do systematically to address this, and how could we all partner to get more data around this to create solutions?
First and foremost would be to collect data. Unfortunately for us, we come under the big umbrella of Asians. And I was trying to talk to one of the counties and ask them for some data, because it helps us with our grants too. We need the money to help our clients. You take them to a lawyer. If it's a family law case, it's not a one-off session, or like Archana knows, it's not a one-off session with a therapist. We need the money. So when we asked the county, they said, go and look at the languages spoken in the school. English, Spanish, Chinese, and then there were 8 or 9 South Asian languages, but we are all separated, so there is no data.
Yeah.
We would love to work with either you, Tasha, your group, or anybody else who could help us find it. We can give you our numbers. We can try and find ways to do it, but we need those numbers. That's the only way to help our community.
Dr. Dogra?
Yeah, absolutely. Is to be able to make sure that, the cultural places keep coming to mind. The cultural events and the spiritual places, as Jaya mentioned, they're just super crucial to be able to reach out to the members and just spread the word, because it's there. Everybody the emphasis is to hide in the community, is to not to be able to say, because is to cover it up as much as you can, and allow the victim to be able to feel empowered to hear their story, for them to be able to share their story in any platform, on any possible way. Hearing that narrative is just so crucial.
Thank you for that. Well, we're right over time. So I want to thank you both for joining us today, for the audience members for tuning in. This is such an important topic, and want to remind everyone the entire month of October is Domestic Violence Awareness Month. Please, let's carry this conversation over to social media, and the hashtag that the theme of this year, and the hashtag is #everyone knows someone. So let's continue this online, and thank you all for joining. Have a great day.
Thank you.
Thank you, Tasha.
Bye.
Thank you.